We're seeing that the microbiome has an important role in many neurological diseases, for example, autism, Parkinson's, and other conditions. And in many ways, it's not a surprise. We have a huge load of, for example, gut bacteria. These are metabolically active, genetically diverse, changing all the time. And it's not a surprise, perhaps, that they should influence other aspects of human physiology and pathophysiology. And therefore, it's no real surprise, I think, that it should also be something we need to be thinking about seriously in the epilepsies. There's so much still we don't understand about the epilepsies, and we need to be looking beyond our current remit, current scope, to think about other possible influences. And we've seen already with a very interesting paper published in Cell this year about how the ketogenic diet, for example, might act through the gut microbiota to influence seizure control. There are plenty of challenges associated with studying the microbiome in the epilepsies. We're already seeing how complex even analysis of a 3 billion letter genome can be, and how complicated imaging analysis can be. And we're now talking about perhaps orders of magnitude of complexity greater than that, with interactions between the microbiome, between epigenetics, between metabolomics, diet, inheritance of the microbiome, and we've heard, for example, how stable the gut microbiome is. So you can try to influence it in various ways, for example, by using probiotics. And what you find is that very soon it goes back to its original form. So there's certainly many complexities to be considered. And really to structure studies that can address all of these is going to be a significant challenge. We know that there are still so many people with epilepsy whose seizures we can't effectively treat with the treatments we have available now, whether they're drugs or devices or surgery. And we know that even the treatments that we do have many adverse effects that we would rather not expose our patients to. There's a feeling, I think, that perhaps the gut microbiome offers a way to achieve some of these aims, perhaps without some of the complications. I mean, we don't know for certain yet. But it may be that consistent dietary changes over a period of time, coupled with other measures, and I think this brings into play the whole idea of holistic medicine, may actually be able to influence seizure control in at least some individuals with epilepsy. But really, we're at the very start of this field, and we need to do a lot more work in order to really understand this better and use it effectively.